It's like an allergic reaction.
It just depends on like what.
I wanted to see this, I didn't know this was on the site.
Oh,
Do you ever find
they're
out
gonna webcast it?
So you can do something, but.
They have a Zoom.
So thank you so much to everyone who's here today. And for those of you who don't know, we are the directors of Pranam. And Pranam is an organization that's dedicated to improving literacy in traditional medicine and other types of non-allopathic healthcare systems. So today, Dr. Mehta is going to be talking to us about integrative medicine, and he's part of the Mind and Body Institute, and he's going to share about that today.
Thank you for coming, and we're very excited for his talk.
Thank you to all of you for letting me here. It's my first time here at UNC campus, so it's cool to be here. Everyone can hear me? Online people can hear me? Okay, we're good? Yeah. We're good? Okay, all right. All right, well, so my name is Darshan Mehta. I'm a general internal medicine physician, and I thought what I would do today is really talk a little bit about something that's very near and dear to my heart, which is mind-body medicine, and why it matters. And I actually didn't this wasn't my planned route in medicine. You know, when I thought I was going to go to medical school, I thought it was okay, I'm going to be a primary care provider, general internal medicine, primary care provider, go into private practice, and I'm done. Like that was like a set path. It was like, but you know, sometimes your path is different than what you originally thought, and that's sort of the journey in medicine. And you learn, and I wanted to share with you a little bit about how I got here into this field, what this field has to offer, and what is some of the things to be looking forward to in the future. And I think this is like a very exciting time in the field. So, right. So, is this reality? This job has cost me my health, my family, and my soul. Can I get a receipt? Right? Some of us, you will encounter, those of you, if you're thinking about going to medicine, you will undoubtedly encounter some faculty member or somebody who will feel this way at some point, because medicine is a very tough road. And it's even tougher now than it was then, because it's very complicated and complex, and the reasons you thought you were going into medicine may not be what you actually end up doing in medicine, and it's just but for me, you know, you also learn that the work that you do is also very you're dealing with the nature of human beings' lived experience. And that's tough. You know, people live very complex lives, and when you're receiving it or holding space for it, it actually can be quite a bit. And that's just something to think about, like how do we actually restore ourselves? And this is one of the paths that led me into mind-body medicine, thinking of as a restorative pathway of why I'm in this work. So what I'm going to cover today, I want to talk a little bit about definitions. We're going to talk about relationship, a little bit about neuroplasticity in the brain and mind-body medicine. We'll talk about some of the research and theoretical frameworks, and I'm going to give some illustrations. This is not meant to be a comprehensive review of research. There's so much out there, but the idea of what types of work is out there. So you have a sense of what, if you're interested in this, like what are the ways you can actually enter this field from, and then future directions. So here's an example. This is a patient that I actually encountered in my residency training. A 35-year-old gentleman, no significant medical history, presented for routine physical exam. Right? And so the family history was significant that the father passed away from lymphoma. The mother had a long-standing history of hypertension, high blood pressure. He was recently married. He worked in the IT industry that required a significant amount of travel and denied any tobacco, alcohol, or illicit drug use. And due to travel, tended to eat a lot of fast food. So when you look at this at the get-go, you think, okay, this seems pretty straightforward, right? Nothing really going on here. There's just, you know, and so now I know many of you here are not clinicians or have just had some introductions into clinical thinking and how we think in clinic, but are there some warning signs that you see about this individual? And just say it out loud. What are some warning signs? Like, oh,
Fast food.
fast food. Yeah, okay. What else?
Hypertension.
Okay, the family history of hypertension, high blood pressure,
IT industry tends to want sedentary.
sedentary lifestyle, good, yeah. Okay, anything else? Yeah,
Talking about some traveling, a lot of inconsistency, like sleep. and all
good,
that.
yeah. So all of a sudden, but we're not taught today, so it's the travel, inconsistency of sleep. And so those are, come on in. Okay, so this is something that, okay, well, how do we make sense of this, right? Like, all right, so let's go further. The physical exam. I imagine many of you had a physical exam at some point. So body mass index is 31, which is an elevated body mass index, sort of just borderline, sort of what we would call class 1 obesity. Blood pressure is slightly elevated, 135, it's like a little bit high, but no other remarkable findings. Labs, the good cholesterol, the HDL is 41, kind of borderline low. LDL, the bad cholesterol, 148, borderline high. Triglycerides, 150, borderline high. The fasting plasma glucose, 120, it's borderline high. It's like sort of all these sort of borderlines or just slightly high or slightly dysregulated. So at that time, we said, okay, the blood pressure, hypertension, we call this metabolic syndrome when you have a constellation of all these sort of factors, a little bit of this, a little bit of that, a little bit of this, a little bit of that. And then, and basically then says, well, patient does not want, I said, well, at that time we said, the way we were taught is like, for every ill, there's a pill, right? That's how we were taught. So we said, but I don't want medication. So I thought, let's start some blood pressure medicine and stuff. And I thought, okay, well, diet and exercise sounds well. How do we do diet counseling? How do we learn how to do diet counseling in medical school? At that time, how do we, this is a residency actually, this is a past medical school. How do we learn how to do diet counseling? Did anyone want to guess how we learned at that time? What do we tell people with diet counseling?
Call the nutritionist.
Called the that's a lot. Yeah, no, we didn't even say that much. What, anyone? 2 words. I said, eat less. That was my diet counseling. That was all. That's all I told. Eat less. And what do you think I did? Exercise counseling. How was I taught to do exercise?
Move more.
Move more, do more. I said do more. That's it. Eat less, do more. That's, I check off the box. I did counseling, right? And then he's like, okay, thank you, but no thank you. Doc, what do you think about this? So brings in this magazine. Okay, we had magazines in the waiting room and stuff, right, back in those days. And you just tell you, like, this is in the middle of my residency, 2003. Brings in this, so the science of meditation, new age mumbo jumbo, not for millions of Americans, meditate for health and well-being. Here's how it works. I was like, whoa. Just like this brought up 2 very interesting issues for me. Like, first of all, I never thought of, does anyone recognize who this is, by the way? It's actually this thing is blocking it, who it is, so that's good. Does anyone know, recognize? Nobody? Oh boy. So this is actress Heather Graham, okay, who has been practicing transcendental meditation since 1991. Now, it brought up 2 interesting things for me. One is that I never thought of meditation as a health construct. I thought it was something that people did, like I had a belief in my own sense of spiritual growth, and this is like, it was part of my own practice that way, but I never thought it was a health intervention. But the second question that it raises is like, do you have to look like this to practice it, right? Because all the images out in the media were like something like this. This is actually, by the way, this predates the era of Lululemon and Athleta, just so you know, but you can see like the origins were there, right? And you think about like, this is how people started thinking, like you have to have a certain body type, you have to, it really sort of catered to a particular type of individual. And when you look at images around people, like it was often something that looked like this, right? Which sort of excludes the majority of the population. So, all right, so here's what we know. So we know that non-communicable diseases are the most important global health challenges of the 21st century in terms of disease burden and mortality. And we learned that actually even more so in the COVID pandemic, because the people who are most affected by communicable disease were the ones who had the most number of non-communicable diseases, right? Those are the highest people who are the highest risk. And when we think about stress physiology, we begin to now, let's break it down a little bit, right? So we have stressors in our lives, right? So all of you have probably experienced some of this at some point. family relationships, disagreements, financial worries, the need to succeed. I heard you guys have the system of like 3 midterms and an exam. Like, I don't know how you have 3 midterms and it's, but it's something interesting, right? Friends, decisions, new situations, these are all stressors. And then you get into this alarm mode and you have what some of you have heard, the fight or flight response, right? So you fight or you run and then you return back to normal physiology. And then you might have coping strategies. Some of you might exercise or you might talk to a friend or something. Those are different coping strategies. And that also allows you to know. But if you don't cope, then you begin to have negative thoughts, poor diet, lack of exercise, inappropriate responses. In the pandemic, I realized that for me, because I wasn't coping as well because of the uncertainty of the situations, that I began to become a late night snacker. Like that was my thing. Peanuts, salty peanuts was my thing. I don't know why, but I was like, and the Indian style salty peanuts. Those are the things I loved. But that leads to then sleep issues, irritability, blood pressures for some people, depression for some people, exhaustion, and you have disease and mental breakdown. We can get into even more of the detailed physiology. I don't want to belabor this too much, but you can see like at the level of the brain, you have things that affect like developmental history, stress, nutrition, aging, genetic, that affects our stress system. There's these 2 major axes, the hypothalamic pituitary axis, the systemic sympathetic adrenomedullary system, and then you can see that affects target tissues. There are all these hormones. And ultimately there's end organ damage. But again, people don't know this. They're not going to feel this. What they feel is this, right? You feel like you're always like sort of balancing things. You feel like it could be, retirement for some people, if you have change in relationship status, achievement, illness, finances, all this stuff affects us. And then even at the level of an organization. So if you work for an organization, and you have factors that affects the individual, your relationships, the stressors could be relationships at work. Like when you enter the workforce, majority of your wakeful life is not with your family. It's actually with the people you work with, right? So if you don't have people you work with that you enjoy working with them, that's a big stressor. If the organizational culture is not good, healthy, like it doesn't promote a sense of like meaning and purpose and well-being, that makes it hard. If your homework interface is a challenge, or there's a career development issue, that affects individuals. And at the individual level, as we mentioned, it can affect the way illness, work exit. But at the organizational level, there are some things that are bad for an organization. If you don't show up to work, that's bad for an organization, right? But maybe even worse might be if you show up for work but not really present. You're kind of just mulling around and just sort of just making it through. And that leads to dysfunction, higher costs, even lawsuits and stuff. So what we know, even to this is a 1960, my mentor, Dr. Benson, who passed away a few years ago, he would quote this slide. Okay, and this is one of these things when you're like, you think you're this like, you have a little bit of attitude, and you're like I was a young faculty member, like Dr. Benson, put it on the slide, there's no reference to it. What's the reference to that statistic? He's like, that's a good point, go find it out. So I had to go to the stacks of Harvard's medical school library, found this old paper, 1964, a journal that doesn't even exist anymore, called Journal of Chronic Diseases. And it was actually a study done by another well-known physician in the Boston area who basically just cataloged why people came to the clinic. And they found that 69% healthcare visits are related to stress. That's actually true today too, it turns out. That hasn't changed. When you think about when people when you've gone to a physician or any healthcare professional, most people don't go there. It's like, oh, I'm so happy I get to go meet my provider. There's often, and I'm like, there's something that you're worried about or concerned about. And that already, so by definition, you're already entering a visit in a stressful way. So now let's go back. What is mind-body medicine, right? Do you hear this term mind-body medicine? This is a definition that I actually like. They've actually pulled it off of the government website, NIH's website, but I still like it, so I'm still keeping it because I think it is actually really good. It's the interactions among the brain, mind, body, and behavior, and on the powerful ways in which emotional, mental, social, spiritual, and behavioral factors can directly affect health. It regards as fundamental an approach that respects and enhances each person's capacity for self-knowledge and self-care, and emphasizes techniques that are grounded in this approach. So the core of this is self-knowledge and self-care. And that really connects the spirit with the mind and the body, right? When you think about self-knowledge and self-care, that is what this field is all about. And for me, that actually helped really bring this to a sense of whole person. When you talk about like, what does it mean to treat, like it's mind, body, and spirit, whole person. All right, so now I'm gonna take in a whirlwind tour. How did mind-body medicine look like, what it looks like today? In particular, this is in a US context, but this is actually adapted from, there's a professor of history of science at Harvard University, Professor Ann Harrington, who's written about this, and I sort of took in nuggets from her work into this presentation. So stress in the modern life is the first thing. So it's hard charging business ability. Someone's about to learn that continuous stress does inhibit one's memory. How many of you had this moment where you kind of just like, you don't even know where, like you just run out the door, right? And in the US, the emergence of stress in the modern life, there have been all these different words for stress. One of the old word was neurasthenia. We don't actually use that word as much, but every now and then it comes up. President Theodore Roosevelt had the diagnosis of neurasthenia. Does anyone know how he treated his neurasthenia? Any history people out there? Yes.
You go into the woods and he retreated there for a few months.
Okay, he went to the woods, but what did he like to do?
Shoot.
Hunt. Yes, he was a hunter. President Theodore loved to hunt. That was the genesis, by the way, of our national park system. Because in every state, when he wanted to, he was just like hearing the complaints of the constituents. He's like, I can't take him, I need to go. And so he had to, so that's, now the rules in the national parks have changed, but originally it was a place for him to hunt. There's the, as I mentioned, the fight or flight response. This was coined by a physiologist at Harvard Medical School, Walter Cannon. And he talked about this increase of blood sugar, adrenaline, dilation of your pupils, the piloerection, so the hair standing up. So the question is this a good thing or bad? Because whenever you see the word I'm stressed, always say it's bad, right? Like it's a bad thing, really bad. But is it always bad? It's not, right? So if a bear is coming in front of you, you don't want to sit and meditate. It won't help your survival, right? So the stress response is actually very important. It was an essential part of our survival as a species. But then, if we keep engaging in the stress response, that's where it becomes problem. Like as if the bear is in front of us all the time, like right now. Like some of you might be thinking about your exams. I mean, right? Like, oh, whew, you can feel it, like how you're clenching your, your body or your fists. And that's like, let's talk a little about the psychology of it. This is Richard Lazarus and Susan Folkman, eminent Richard Lazarus passed away. Susan Folkman she's retired, but still from UC Berkeley and UCSF. Stress is a process in which environmental demands tax or exceed the adaptive capacity of an organism and may result in psychological and or biological changes that may place persons at risk for disease. So the stressors are environmental experiences. And then the appraisal are the subjective evaluation of the stressfulness of the situation, right? So if you're going in traffic, some people can be very, okay, it's just traffic, we'll get there. And some people be like, right? Like they're just like, really are trying, like they're really intense, right? And you have that sense of road rage, you'll see. But it's the same situation, but the appraisal is different. And then the stress response, the affective, behavioral, biological responses to stressors or appraisals. So now let's talk about the laboratory. Like, how do we study stress? Like the laboratory did. And this is a physiologist, Hans Selye, who then really thought, like, okay, how many of you describe yourselves as type A? Anyone say I'm type A? Yeah. What does that mean? What does that mean when you say I am type A personality?
Very highly organized.
Highly organized.
Multiple different organization systems like
Okay.
to-do lists and like
Okay.
calendars and.
Okay, so that's it. Okay. What's your definition?
Similar, also high functioning.
High functioning, highly organized. So type A personality was actually was people who they were found to be people who were at that time when the studies were originally done, that they were at high risk of having a heart attack. That was a type A personality. turns out. It turns out the studies were flawed, so it turns out they didn't account for a lot of things, but that was it. The word has still stayed, because they described this personality. We actually forgotten what type B and C were. There were also type B and C personalities in these studies, but we've forgotten what those are. But then I'm going to show you this amazing study of stress and a link to the immune system. Okay. Hans Selye really said that, we talk about stress at one point in time, but what happens over the course of a lifetime when you keep hitting that system over and over and over and over? And that's called, and he called this term the general adaptation syndrome. Now, this is a brilliant study. They took healthy students and said, okay, we're going to give you a little honorarium. We're going to put you up in a hotel room for a few nights. But here's what the study is. We're going to inoculate you with the virus that causes a cold. We just want to see who develops the cold and for how long. Okay? And before we do this, we're going to measure them. He had developed this, Sheldon Cohen, he had developed this index. He called it psychological stress index. It's now called the perceived stress scale. And he said, let's measure how much stress you're in, okay, before you start. We put this virus up your nose. And so you can see, you don't have to be, I know there's some biostats people in here, but very clearly, stress goes up, the number percentage of infections, it goes up, right? Like this is published in the New England Journal of Medicine in 1991. It was the first study of its kind. It was landmark study. Like no one had ever done this type of experiment, randomized study, and it was randomized to 5 different viruses that cause the cold, okay? So RV stands for rhinovirus. That's the one that causes the cold. RSV, some of you heard, respiratory syncytial virus, right? And you can see like they looked at high stress versus those who were the top quartile versus lowest quartile, low stress versus high stress, right? Now, there's this one at the bottom, like one at the bottom, like that's like really what, like the other one's like kind of, that one's like way at the top, right? Like clearly like looks a little bit different, very robust response. The top people like with high stress, they really got the cold. And the bottom says CV. What does CV stand for?
Control.
No. Which virus?
Coronavirus.
Coronavirus. 1991, we studied coronavirus. Now, this is not the same. It's a relative of the one that we had in the pandemic, but it's still a coronavirus. And look how susceptible to stress it is. Pretty impressive, right? No one had, like sometimes when you look at studies, like they'll put these data tables, and if you don't look at the study detail, you miss some of the interesting messages. Because they didn't really talk, they showed this graph, they didn't really talk about it, except to say that all viruses were affected, right? But this one like clearly looks at it. He actually writes about this because what happens 30 years later? 2021? He comments on this study 30 years ago and says, oh yeah. He has to be cautious in how he says it, but he's like, probably should look at that in a little more detail, right? So it turns out, how many messages did you get when you were during the pandemic? It says, make sure you reduce your stress, so that can help reduce your risk of infection. Did anyone get that message? No, right? One of these public health messages that was missed. So it doesn't take away from mask wearing, it doesn't take away from getting vaccine, hand washing, 6 distancing, all these things we talked about. But we missed one big message. Okay? So here's another one. Interesting, right? This was a study. We looked at people who meditated, who got the vaccine, and they randomized 2 groups. Health information, like, okay, make sure you, get enough sleep, make sure you do eat well, do this. And the other one, they taught them meditation. And in 8 weeks, you can see that people who got the vaccine who meditated, their vaccine titer response doubled than the ones that just got health information. So again, when you think about when you go for a vaccine, how many of you got, actually, I wouldn't ask anyone to disclose themselves here, but if you've gotten a vaccine, how often have you meditated when you've gotten a vaccine? Right? Interesting, right? So another very interesting message here. So why is that? So meditation, we know that it affects activities on inflammation, cell-mediated immunity, even biological aging. Like these are things, processes that we know that are affected. So when we think about this in totality, this is this concept that we talk about. We look at our individual differences at gene levels. We look at environmental stressors, major life events, history of trauma and abuse. All these things actually affect the way in which we perceive stress, their behavioral responses, physiologic responses, and our ability to adapt is what we call allostasis. So when we have increased allostatic load, like when there's a stressor in front of us, can you mount that stress response? And when that stressor goes away, can you return back? And if you are able to do that, that's allostasis. If you're not able to do that, that becomes because of the increased load. Now, we know that the brain actually, it turns out, is exceptionally plastic. You guys are most of, in children, adolescents, we know that the brains are exceptionally plastic. But turns out, while it might decrease with age, it still persists throughout life. And it's not limited to specific age ranges. So we really know that even in adulthood, the brain is actually extremely adaptable. And multiple factors can actually affect and continue to shape its structure. In meditation, when in mind-body practices, we know that there are particular parts of the brain that are really affected. And it's the parts that make us uniquely human. So the part of the brain that is different from us than other mammals is the prefrontal cortex. Like that is the uniquely human part of the brain. And it is, and that's where meditation and mind-body practices, because when you think about it, really no other mammalian species can meditate. It's a very uniquely human activity, right? And so that affects the prefrontal cortex, but also affects what we call the sort of the quote unquote, the reptilian part of the brain, the amygdala, which is where sort of the emotional center and the reactive center lives. And that also is affected as well. There's structural changes and functional changes as well. And I'm going to show you some interesting, so this is some famous studies that looked at when in long-term meditators, they found that these are people who had over 10,000 hours of practice, that their parts of the prefrontal cortex got thicker. So that actually challenged the conventional wisdom that as we get older, our brains shrink. But turns out maybe not so. That may not be the case. And people who actually had this input. They're also, these are the regions of the brain. These are cognition, executive function, ability to make decisions, emotion regulation, and neurotransmitter release are all affected. Now, let's look at another study. Mind-body practices really are, there's a basis of it is really on power suggestion, right? So this is a study that looked at healthy individuals again, and they basically said, okay, we're going to shock you and tell us, okay, what's your response? How much pain are you experiencing? And then we're going to give you this pill. And it's meant to mitigate the response to the shock. So tell us what happens, right? So you can, but one group was told that you're going to get the regular price stuff, and the other people were told that you're going to get the low price. Okay, but and you can clearly see that as shock intensity increases, the difference, the people who thought they got the regular price stuff, they had a much bigger difference in the pain response. They were able to do much bigger responses. At some level, you shock somebody, it's so high, you can't really have, everyone feels pain. And the low price, they had a lower, you can see very clearly. But now, what they didn't know is that all of them got placebo. They didn't get anything. They thought they were getting it. They're all getting the same placebo. And you can see that how we suggest actually affects the degree to which we respond to pain. So that tells you there's an interplay between the mind and the brain, because the way we learn, experience new things, it actually strengthens new neural connections, the formation of new synapses. And these are why these processes like problem solving, critical thinking, what we do in college, like, especially here, like when we're doing problem solving, like most people don't think, they don't think about the pain, if they're like, because they're so engaged in these activities. And they actually help stimulate, define more efficient pathways. So we know that there are emotions that can lead to changes in brain structure and function. The positive emotions contribute to, positive release of neurotransmitter dopamine that promotes neural growth and connectivity. Chronic stress has detrimental effects. But the other things that we know that these things actually can influence the stability and strength of connections between neurons. So now when we look at meditation activity, it turns out it's not like just one part of the brain. It's shifting all the time. So if some of you practice meditation, you first start off, you're like, your mind is wandering. Oh, it's going everywhere, right? And you're like, wait, then you realize, oh, wait, my mind is somewhere else. Like some of you right now, again, you might be thinking about the exam coming up, right? You may not be here in this present, might be somewhere else, but here you are. Then you realize, oh, wait, I got to reorient myself to the awareness. Okay. Then you sustain the focus. And then over time, then your mind wanders off again. And you kind of do the cycle again. And that's the practice. It's over and over. And you can see when that happens, look at all the different things light up in the brain. And that's what's happening. So we know that now, because through our understanding of neuroplasticity, that there's improved mental health and well-being, there's enhanced cognitive function, resilience, and the potential impact on physical health. We actually look at something like yoga, and we find that practices of yoga actually can have changes that are at the genetic, neurochemical, synapse, cellular, neuroanatomical, neural, and behavioral mechanisms. And you can see there are all these different things that can be impacted by it. Okay, another part of mind body medicine, positive thinking, right? The people have power, and there is a power to it. And here it is. I want you to take this placebo 2 times a day for 10 days. If your condition doesn't improve, I'll give you a stronger one. Okay. So let's talk about that a little bit. What is the positive? So this is a brilliant study. As an educator, I showed the study to my students all the time. So this is a study that looked at irritable bowel syndrome, which is a condition for which we don't really have much treatment for. And so there were 3 groups. There's a wait list group. So you basically I get to be in a study. And they say, okay, come back in 12 weeks. You're going to be in the study, but come back in 12 weeks. That's when we'll enroll you. Then there's people that the limited, and this was a study that looked at acupuncture. So the acupuncturists would go in and say, okay, we're going to put needles at these points in your body. It was a very scripted encounter. I'm going to come back in 20 minutes. We'll take the needles out, go home. And then they would do that every week for a period of 6 weeks, twice a week. And then there was the augmented encounter. This was like tell me how you're doing, how's your pain. This is the acupuncture would have a list of questions that what is, how did you feel from last time? How's everything going at home? They would ask a very thorough history. That's what they call the augmented encounter. And so they put the needles and then go. Now, you can see that just the idea of I'm going to be in a study, people improved in 6 weeks. Okay? So they say, oh, I get to be in a study. They ain't got anything, but the idea that I might get to be in something. Limited encounter, they improved a little bit more. And those at the empathetic or augmented encounter, they improved the most, right? You can see this. Now, what everyone didn't know in the study is that nobody got anything. The needles they thought they were getting were actually, they were specially designed that when they would put it on the skin, it would retract upwards. So it would never pierce the skin. It actually would just retract upwards. And it was so well blinded that half the people, when you think, what's a perfectly blinded study? It's when 50% of people think they got the intervention and some didn't. And that was perfectly blinded study. They got nothing, right? Ultimately. And yet, what happened was at 6 weeks, you see clearly there's a stepwise improvement. And this is a standardized score that has been used previously to get FDA approval on medications for irritable bowel syndrome. It's sustained at 12 weeks, the effects, right? Now, they actually they actually showed these studies, blinded the study to the FDA, and they said, which drug is it? We want to approve this right away. Because this would have been used to approve it. So that's just interesting, right? So this is the idea that there's an idea of remembered wellness and belief in the therapy, right? And I think this is one of the things that come through and through. A lot of mind-body medicine is also based on this idea of healing network. People come in community. This idea of and especially in the US, there's the idea of a group effect. And this comes from this study of Roseto, Pennsylvania, a small coal mining town, central Pennsylvania, Italian immigrant community. And in 1950, they said, wow, they live longer. What's about this community? Why are they living 10 years longer than the adjacent communities? They said, well, it's not occupation. Everyone was coal mining towns. They thought, okay, well, maybe it's that Mediterranean diet, that olive oil, all that must be that time. I mean, these are 4 generations in, they were all on the SAD diet, right? The standard American diet. We call it the SAD diet, right? So that wasn't it. Then it was tobacco use, maybe it's SAD, none of the factors. You can think of it, alcohol consumption, all these factors The only thing that was a factor was different is that they lived in Roseto. The adjacent communities were German immigrant communities, whereas these were Italian. And in this one, they lived in a multi-generational homes. And when somebody in the community fell, the whole community came to pick that person up. That explained the difference in life expectancy, turns out. Okay. And then 50 years later, in 2000, they looked at it because coal mining is no longer really a profession in many states anymore. And the communities and all the life expectancy differences disappeared. And then the next theme, eastward journeys. The idea that there was this interesting thing that happened in the 60s and 70s. There was a whole countercultural movement that sort of moved to the east. The Beatles actually were responsible for this. They had a musical influence. They were influenced highly by this individual, the Maharishi Mahesh Yogi, in Transcendental Meditation. There are other things. Some of you may know these names: Thich Nhat Hanh, Paramahansa Yogananda. There are also non-Asian mystical practice like centering prayer, Kabbalah, Sufism. But this is Maharishi Mahesh Yogi. He actually was at Woodstock. And then he moved in Beatles, and he moved to science and physiology and this idea of like there's a major state of consciousness. And then Dr. Benson, he actually then collaborated. He actually studied this and said that this is actually a physiological state that counteracts the negative effects of the stress response. And he coined that term as the relaxation response. He then started working with the Dalai Lama, and he basically said that there's two factors by which it's evoked: a repetition of word, sound, phrase, thought, or muscular and a passive return to repetition when other thoughts intrude. So it's about breaking the train of everyday thought. And you can see the benefits as 15 minutes, 1 to 2 times a day. And Dr. Benson was a cardiologist, so his original work was in blood pressure. And he found these effects were as strong as medication. And that was the genesis of the field of mind-body medicine. There was a famous journalist by the name of Bill Moyers, who passed away. And he, in the 90s, on PBS, he would feature this Healing in the Mind series, and just blew this field into the open, that there are all these practices in mind. And he featured, and one of the people he featured was a guy named Jon Kabat-Zinn, who wrote this famous book called Full Catastrophe Living, which was a New York Times bestseller. And it was this program called Mindfulness-Based Stress Reduction, MBSR, which is a clinical program, and its origins are in Buddhist meditation practices and Vipassana. So it's a psychological state of intentional, non-judgmental, present moment awareness. So this is now what's happening today. This is my clinic. Like, I'm learning how to relax, doctor, but I want to relax better and faster. I want to be on the cutting edge of relaxation, right? And this is literally what happens day in and day out from my work, because there's stuff that's happening. We see that meditation changes gene expression. Your genes might be fixed, but how they get turned on and off actually turns out can be modulated by meditation practices. And so there's decrease in inflammatory pathways. Your insulin is utilized better. There's an energy differences and energy production differences. And these are heat maps. Some of you may be doing this type of research. They show that even in little as 8 weeks, you can show differences in gene expression. And this is something that has really was a game changer in the field. Which means now that we know that some people might respond better. So we're now in this space of what we call personalized medicine, where we hope to predict that, okay, you have blood pressure. I think, and I know your epigenetic profile, I think you're going to respond better to meditation. You need to start practicing. That is where we're coming to now. Because we can actually start to do these types of things because of the way we know about response. So what we know is that these things, change the process in cellular death, apoptosis, stress response, inflammation, and this ultimately has differences in life expectancy. This is in patients with moderate to severe coronary disease. When you add a meditation component to a cardiac rehabilitation program, in 3 years, you see differences in mortality, right? So if they learn to practice this, turns out even in as little as 3 years, you can actually affect someone's life trajectory. It turns out it saves money too, right? And that's been a big reason why some of these things are being looked at more critically. It decreases healthcare utilization. So some of the biggest drivers of why people come to the emergency room or some like high cost, they get an extra MRI test done or something, like things that cost the system a lot of money, we can reduce that. So now we see like research, like there's just so much research, like treatment of anxiety. We can see that it can actually help with mild cognitive decline. we can see that when we do this, there's people with even just having executive function concerns. So there are lots of different studies in which this is being done in major medical journals, and you're just going to see more and more of this happen because it's just the research is just exploding. So ultimately, what is this equation we're looking at? We're looking at stress, allostatic load that we talked about. We're looking at your resiliency factors and social support, and we're trying to predict someone's propensity to illness. If you flip this equation, the inverse is someone's propensity to wellness. It's exploded in use. Like this is old statistics now because they don't update it anymore. But like you can see, like even in 5 years, how much explosion of use has been. Particularly in children, we know, like they have like meditation Mondays at my daughter's school, so they practice. It turns out it affects. So what is mind-body medicine ultimately? These are these are healthcare provider-led rituals. It's about having the healing power of the examined life. These are patient-initiated practices and self-empowerment. There's a science behind it, social networks. There's also exotic examination of medical and moral redemption. I talk to patients about their meaning and purpose in life through these practices. Like this is, because that's what matters to them. And it actually blurs the boundaries of religious and secular worlds in a safe way, in a way that actually you can be your own person, they can be theirs, and you can actually have dialogue in that space. We've developed a program at our institute called the SMART program, or Stress Management Resiliency Training. It can be built through a 3-tiered process. And again, these incorporates elements of modern psychotherapy with wisdom traditions through mind-body practices. And so this is sort of the heuristic. You have stress awareness, elicitation, relaxation response, and then building adaptive strategies. And we've kind of developed a whole manualized approach. And we know, again, that these actually help reduce the frequency of medical symptoms, severity of psychiatric symptoms, and increasing health-promoting lifestyles. I've done this work in healthcare professionals now, like I've had the opportunity to lead it in physicians, and we see that this actually helps improve mental health, physical health, and their perceived stress, as well as they enjoy their job more. So when you build a practice, what are we trying to do? And it's really about what we call mindful awareness. It's understanding why is this important in healthcare? Because we want providers and to be able to become more aware of your own processes, listen more attentively, become flexible, recognize our own bias and judgments, and act with principles and compassion. That is ultimately why this is so important in the healthcare system. It's ability to observe the observed while observing the observer. What does that mean? Knowing where you are in relation to the other. And that's the constant thing that we do in medicine. And this requires mentorship and guidance. And again, one of the things about mindful practice, this is work done by Ron Epstein, looking at like, how do we have curiosity? How do we have courage? Beginner's mind, humility, compassion, presence. And there are many benefits. It actually has significant clinical outcomes. And one of the things about this is that we know that this is not something that's unique to one culture. Turns out every culture in the world has a practice that has a focus on one's awareness, and it's observing the feelings and thoughts that come up without judgment. There's ways that people have developed this, and this makes sense because universally human beings all have the stress response. So all cultures will have developed a way to counteract the negative effects of the stress response. And we've done that. Obviously, if you think about the ways in which you have grown up, what are the ways that you were taught to do this? So, so one of the things in this is just, again, practicing this daily. And we'll do at the end here, I'll show you a brief practice. But in addition to this, one of the things that we've done is that this allows opening into thinking about other parts of our life, like our own energy. Like, what is your own energy battery? Like, what are the things that, like, you can understand what drains my battery and what charges it? And are you able to articulate that better? Because the more you articulate, you can actually do something about it. We teach people how to be present in our programs. Thich Nhat Hanh says, if you love someone, the greatest gift you can give them is your presence, right? We understand what are the supports and how do you ask for support and how do you give support? So emotional, informational, tangible support. Like, so these are things in the pandemic we learned, like emotional support, people wanted, and social isolation killed emotional support. Informational support. We were so in such unease when we didn't know what was going to happen. Like, okay, how long do we need to be like this? Like, it was like, first it was like a week, then it was 2 weeks, then it was 3 weeks, a month, 2, 3 months, became 6 months, a year. Tangible, how am I gonna get the groceries? That was a big issue for a lot of people. Affirmational support for healthcare professionals, like, you're good, you're doing good, you're doing good. And belonging, you belong to something. And so one of the things we work on is how do we appreciate? So how do you actually, it turns out there's a lot of data that shows the power of appreciation. But how do you actually open yourself up to the power of appreciation? You have to engage in that stillness that you can actually then appreciate something. So this is what it is. You know, self-care and resilience is not selfish. It's essential for our own well-being, allows us to better take care of others. And this time investment more than pays for itself, it turns out. So the question is, like, when you think about yourself, like, what allows you to feel whole? Have you thought about that? Like, what allows you to really feel whole? And one of the things about this is that we need role models. So the word, I love this, inspire, allows us to motivate. But the other word of inspire, meaning is what? To breathe, right? It's the same word, right? That's the thing. And I always found that really, to me, something that I've held on to. So this idea of really creating space, then for courageous vulnerability. And that's the work, especially in medicine, because we're always taught to be like, you gotta be, you cannot show weakness, you cannot show weakness, you cannot show weakness. And that's where mind-body practice actually helps soften that and really build a skillful place for courageous vulnerability. So I'm just gonna finish up here, talking about a few things of finding meaning. Like for me, how do I find meaning and purpose in this work? Well, first of all, like those that have strong sense of love and belong have the courage to be imperfect. One of the things I've learned in my work is that it's okay to be imperfect. I'm not going to be perfect, but I love and I belong in this work. Like that's the thing. That's the best part of it, and that's what like that's why I get to come here today, and that's why I get to do all the things I love to do. This is the concept of ikigai that some of you heard, the Japanese concept. So what you want to find is like purpose. You love it, the world needs it, you're great at it, and you're paid for it. There's your sweet spot. Find it. That's what it is, right? So it's where you find your passion, your mission, your vocation, and your profession. For me, remembering a person that came through in the pandemic when I was deployed to this convention center. It was like a makeshift hospital they created in Boston, 1,000 beds in a week. I'd never seen anything like it. And I was one of the physicians deployed there. And it just like, I don't know what it was, like it was patients, there was the overflow of patients with COVID, and we were to take care of them. And like we were wearing paint suits and all these masks and everything, but it just, for me, it anchored me like, I'm meant to be here. I know there's uncertainty, but I am meant to be here. But in that, I needed support. And for me, where have I found support? Well, this is for my family. My parents provided tremendous support. I'm going to see my brother's family. They live in Charlotte. I'm going to be visiting them tomorrow. And, they provided a lot of support for me and my daughter. These are my college friends that I hung out with when I was in college. I went to a small liberal arts college in central Illinois. And I lost touch with them. And then going through the pandemic allowed me to reconnect, right? And that's why I look, wait, they're really... Having a mentor, this is my mentor at my work. He's my boss, Dr. Greg Friccione. And there's no greater joy than going to travel with your boss, giving a talk together on the same stage at a yoga festival in Rishikesh in India. That was one of the joys of my life. Like it was like, and it was a really spiritual space for me to be able to share that experience with him. But then learners, I'm the faculty advisor for the South Asian medical students at Harvard Medical School, and we would get together. And yes, this was a time where I felt like I was just as old as they were. But obviously, they jokingly said one time, should we be calling you Dr. Mehta or Darshan Uncle? I'm not sure what to say. But at that time, Tom Brady still played in the NFL. I'm still as old and just a month older than Tom Brady. So I'm not an uncle until he retires. So, but it's been a joyful place. We get to stay young that way. And that to me is important. And then finally, transcendence. Like the idea of this work allows you to connect to something bigger than the self. And when you find that, like this is, it's not, you know, it's like we live in a world that's about I, me, you know, that's, but when you have that sense of connection, something greater than the self, that to me is, for me, has been a reclamation of my own faith tradition, and how does that actually support me in the work that I do? And that's been an important part of my journey. So there's many hurdles left to clear. We got to still do the science. We got to show the clinical efficacy. Got to demonstrate cost effectiveness, biological mechanisms. This is all the work that you guys are going to do. Overcoming bias, convincing skeptics, creating culture change within medicine, broadening accessibility in the community, and using evidence to convince payers and governments that you should be doing this. But here's the take home. There is a neurohormonal, epigenetic, physiological basis. It can be safely delivered. The whole body of evidence. It's really part of the comprehensive treatment and management of multiple medical conditions. And that's what we've seen time and time again. And William James said, the greatest discovery of my generation is that human beings, by changing the inner attitudes of their minds, can change the outer aspects of their lives. It's too bad that more people will not accept this tremendous discovery and begin living with it. Thank you.
Anyone has any questions for Dr. Mehta?
I have just a quick.
Do you, you described, oh God, now it's gonna leave me because I'm old aged, but you also described, it sounded like gratitude, but gratitude was not the word, it was appreciation.
Appreciation, yeah.
So would you define those things as different?
I think some people do. I think for the standpoint of where people are starting from, there is no difference. I think because most people don't do any of it. So just, I think from a starting point, I don't find there are, but some, yes, there are people who will argue the academic difference between the two. But I think from a practical perspective, you just start somewhere. Yeah, yeah, yeah.
You mentioned that patients that come into your clinic and they say, how do I relax better?
Yeah.
And it's like kind of counterproductive because it
Right.
stresses you out more. What do you
Exactly.
usually tell them?
Yeah, so let's practice that right now, right, for a minute. Just indulge me for a moment. All right. So what I would like is desire yourself feel comfortable in your chair. Okay. And as you feel comfortable doing so, just allowing your eyes to gently close, or if you'd like, having a soft gaze toward a spot on the floor, or a table in front of you, or a chair in front of you. Just letting your hands rest in your lap or on your knees. And just taking 1 or 2 deep breaths just to notice where your own breath is. And just noticing if there's any tension in your neck, your shoulders, your back, or your hips. And simply acknowledging that tension and seeing if that tension is necessary for you. And bringing your own awareness to that triangular region surrounded by the bridge of your nose, the edges of your nostrils, and your upper lip. And simply noticing your own breath as it passes through that region. Perhaps it may be fast, might be slow, may be deep, or might be shallow. And perhaps you may notice the gentle touch of your breath as it passes over your upper lip. Whatever you notice, allowing that to be as it is. Not trying to change it in any way, but simply noticing it. If you notice your mind is wandering, simply acknowledging that, and gently but firmly bring your own awareness back to the rhythm of your own breath. And when you feel comfortable doing so, you close your eyes, allowing your eyes to gently open. So, what did you notice? Anyone fall asleep? No? I've done this in a room of surgeons. Half of them out. So it's the cutting edge is what we call the beginner's mind. That's it. You got just as if you're doing it the first time. That is the cutting edge. Is to being able to like think about it as doing it for the very first time again. Yeah.
So when you bring these models into healthcare settings, what's like the first biggest misconception that they have about it?
It's what we said at the beginning, that you gotta look like that to do it. Right? Or you have to wear certain clothing, or it's like we just did right now. And so you don't have to be, I mean, you don't have to go off to some mountain or cave. Not to say that people can't do that, but this is, you experience your stressors every day in multiple different spaces in your life. So you can engage in this in multiple different spaces in your life too.
So might be a bit more touchy question in terms of the culture, like you
Mhm.
mentioned, like, cultural shifts
Yeah.
around this. There seems to be some misconception that since this might be related to quote unquote yoga or mindfulness, some people find it uncomfortable or even like the words demonic or something are used.
Yeah.
I mean, obviously I don't want to focus on the negative, but in terms of like potential cultural issues in practice, like
Yeah.
how see that, how do you deal with
So
it?
I think you have to meet from a health perspective, you meet the patient where they're at.
You can't make them do something that doesn't work for them, obviously.
Right. So but then you find out what does. Most people breathe, right? Everyone breathes. Like breathing is a normal, right? It's a human experience. So that's why I use a breath because can't argue with the breath. You just can't. So I think people are like, oh, okay, oh, that's what it was? Because they often will think like, oh, I'm gonna convert or something like that. But it's, it's not that. You show them, now we have the opportunity of showing data, right? So you, like I've done it where people are wearing a wearable, like a Warrior Apple Watch. Next time you do it, watch your heart rate. See what happens. You're gonna notice, not at all the time, but somebody will know, wow, I actually did. I do it when I'm an inpatient, I'm with residents and we're rounding on patients. And if they're on one of those heart monitors, they show the heart rate and they say they're beating at 120, because maybe they're nervous, maybe they have a heart rhythm or something that might, and you do and you can see, oh, it drops. Like the patient sees it, like, wait, I did that. So they feel empowered. And they will know. Yeah.
Do you, this is your opinion, but do you think that the transcendental like meditation that's necessary to like unlock your peak health, peak happiness?
Yeah.
And have you seen with your patients or just in data with data in general?
Yeah.
That people that that follow these like more like altruistic,
Right.
like bigger purpose mindsets, are they happier and healthier than people that are stuck in like you said?
I don't know, but I think we've always talked about this as treatment of illness. I think the new era of health is like, it's this concept, it's another talk I gave called salutogenesis. What does creation of health mean? Like, what do you mean to create health? And that's a different construct altogether. So the idea of like, what does it mean to be optimally healthy? No one knows that because we've never really gone there quite yet. We've always talked about like, how do we treat what's broken, heal what's broken? But we've never talked about like what does it mean to actually live fully? And I think those are constructs to be examined further.
I guess with like things like yoga and meditation, a lot of people think that it's something you do to go from baseline to like that sort of transcendental state, but
Mhm.
not necessarily something that you take when like you're at a lower state, like to get to your baseline or to
Yeah.
get to the healthy state.
Yeah.
So I guess my question is like, is there a difference in like the type of like practice you would
Yeah.
apply to get to those two types of?
Well, I think a lot of times people, when they think of particularly yoga, practice like yoga, they think of it as just as another form of exercise, as opposed to having a sort of a multi-dimensional construct. So that's, I think most of it is thought of as like, oh, this is just another exercise. Would not take away the physical exercise piece of it, it does, but there may be more than that. And that's something. So again, I don't think we understand yet. We don't know what is optimal, healthy. Nobody knows that. No one's actually thought about that. I think that's an area where there's lots of excitement. There's a question, I think, on this side. Yeah.
Amrita, you briefly mentioned that you used mind-body medicine as a tool to connect with patients and engage in conversations about meaning.
Yeah. Yeah.
Can you elaborate more on how you approached that and what you took away from that or what patients took away?
No, I think, I don't know if there's, I think it creates openness to what matters most in someone's life. And again, there's not a way of like, I think you just see, you experience it because people just are just a little, okay, this is what matters to me. I mean, and then that happens. And I think the thing is that for me, I've been like, that it can happen even in the first visit. Like I can go like, this is what's important to you. Okay, let's focus on that. How do we want to get there? And again, and they get to be the driver of their own health. And that's the most important piece.
First of all, I just wanted to say thank you so much. I know especially right now, like midterm season and the end of the semester, like it's really hard to kind of be grounded and remember that sense of purpose and doing something greater than yourself. And just thank you so much for discussing that. I think that's something that we can all sort of relate to. I know you're talking about this in the presentation, you can't support others if you don't have your own oxygen mask on. How do you see these interventions being deployed in like a curriculum sense for providers and, addressing provider burnout? What are the barriers to that?
That's a great question. I mean, it's a very complex topic of what we think, like, what are the factors? So there's always systems factors and, the complexity of healthcare system, and there's sort of the individual factors, and they both are important. There's like one is more important. But my area of interest has been like, what is the individual, what do we do to support the individual in parallel with the systems? A lot of people do like, electronic health records supports, and now artificial intelligence and documentation and all these things, like not having to get prior authorizations, and prescriptions should be easier to get, and all these things. Like all these things are right. Number of clicks you have to do, like people have measured that. But I think like ultimately like the sense of what does it mean to be human is like, and just honoring our own humanity in this and that. And these are some of the things I think practice that do that, like allows us to explore our own humanity. And again, as I read, it creates space for courageous vulnerability. Most healthcare professionals are taught not to be vulnerable, whether it's implicit or explicit, but we're taught not to be vulnerable. And so that's a whole cultural shift that has to happen to really promote better healthcare. Like it's okay to be vulnerable because we're not any different than the patients we serve. We're just as human. And I think once we have that sort of humility around that, then it's okay. That's important. Yeah. You got a question back? Yeah.
So I was more curious about from like biostatistics study design. Like, what do you think the next step should be in studying like mind-body medicine? Would it be something like studying epigenetic factors like cancer, like male pattern baldness, like cortisol levels, or do you think it would be something more like primary care provider stress levels versus meditating, like one like the control group that like doesn't meditate and experimental that does?
I would say study what interests you, right? There's no like, there's always something to be studied. I don't think there is like, what's it? I think the next sort of exciting pathway is like, what, who benefits and what do we prescribe them, right? Like, I think if you do this meditation, that will help you sleep better. And that level of personalization is going to be interesting to see. And I don't know if we know that yet, but that's where people want to go. So that would be something to research, like how accurate is that?
I'm not sure if you work with pediatrics patients, but with mind-body medicine and all of that, how do you see it like affecting pediatric patients and their care?
Well, I mean, I would say more from standpoint of prevention, right? So most important skill that I think kids learn early or need to is think about emotion regulation. And these types of practices are important for emotion regulation. Because when we think in the era of social media and what impact it can have on brain, social media devices, it's losing that ability to regulate emotionally. Like, you know, if you pay attention, like who's, you know, how disappointed do you feel if someone is not liking you? Right? Like we have that, we've like, all of a sudden you have this desire, like I need to be liked. And if I'm not noticed, then, but that's an emotional regulation piece. So those things is where the mind-body practices, I think, will play a role in early. Because technology is here. It's not like it's gonna, like we can't like, stop using it. Then we have to give better sort of tools to understand, you know, how to regulate better, self-regulate. Yeah.
My question was kind of, how do you see integrative medicine kind of being embedded into the healthcare system, whether it's through putting it in the hands of a physician, deciding whether they want to look at the patient with a holistic view, or be embedded into like curriculum for future physicians?
It's all of it. Yeah, there is no one, I don't think there's like, oh, it's only, it's everything. It's going to be in research, education, and clinical care. And again, it's about the word is sort of now changing, like whole person care. How do we look at the whole person as opposed to, and what are the tools or what are the lens that we need to have to see the whole person? Because there are different ways of looking at, you know, it's sort of like, it's sort of that analogy of the 6 blind men and the elephant, and, you know, like, oh, this is what we think it is, but you have to be able to see the whole person. Yeah.
How much time do you spend with the new patient?
How much time do I spend with it? I spend an hour with every new patient. Yeah. But I'm not, I don't, again, in a medical model, I don't work in a productivity metric. So I'm a loss to the system, but it's an accepted loss. And so that's sort of a privilege I have. It's been so for now, you gotta capitalize on it. Yeah.
Yeah, very good.
Yeah. Yes.
But so is this idea of like integrative medicine something that's only recent in the healthcare field? Like, is that something that like osteopathic doctors have been doing and it's being more integrated into MD fields, or is that something that's?
I think, well, osteopathic medicine has, again, I think there's certain professions that, I think even medicine, I think allopathic medicine have thought of the whole person, but we've thought of it only through sort of a particular lens, and it's sort of over time become more and more narrowed. And now we're gradually expanding, right? So there's a whole field of systems biology that we never used to even think of, and now that's like embedded in curriculum now, systems biology. So how do things interact, you know, with so the interactions are thought of, as opposed to like, I'm just gonna look at muscle, and I'm just gonna look at bone, and I'm just gonna look at this. So I think that's all changing. So, and I think these wisdom traditions have given us some language to think of things that way, because we didn't really use it. We used to say, if you're a kidney doctor, you just look at the kidney. You don't think about the relation of the kidney and the gut. But now I think about actually the gut and the kidney are related, turns out, or something like those things. Yeah.
Just one question in the back.
Yeah. Something back. Yeah.
Do you consider prayer as like a type of meditation, or is it more like somatic based? Because I've seen studies of how praying can different components that all like help reduce the heart rate.
Yep.
Or does this not have?
I mean, prayers again is it depends on the type of prayer, but the repetition of the word or the sound, that's in all the world's traditions. People do it. You know, you have the rosary. So those are things that anchor someone into the practice. Yeah.
Do you also like meditate with your daughter, or is there like a certain age that's too young to start?
Oh, I don't think there's an age too young. I think kids actually teach us that they actually do it. Like they develop sort of ways of self-soothing early on. We may say stop doing it, or we may give them other things to do because it's like, oh, you got to focus on this or focus on that. But the idea of like for my daughter, like for her, like it's that's a part of her. She does. I don't, in the sense like I don't. I actually don't. I don't pay attention because it's part of her own. I want her to know what she needs for herself, because I won't know her lived experience. I don't know the stressors she faces in the world when she goes to school. So the more she's able to sort of anchor into it on her own, I think, again, that is a healthier way to be. You guys can reach out, this is my email, so please feel free to reach out if you want questions and stuff, because we can, these types of dialogues, we can go all night, and we actually have 3-day conferences on all these things, and so, but this is really, this is the, it's a wonderful field to be in, and yeah, if you guys ever want to think about like, how do you get here, happy to chat more, so. So thank you to all of you.
Everyone. For CLA credit, we will have a QR code up there, so you can scan that, and please do take emails. Ask questions. And also, please watch out for Branham's future events. We'll be holding a lot like this, and if you're interested in joining us, be part of conversations and organizing these events and continuing the evidence-based for research, whether it's more outside pursuit support or an actual evidence-based. Come join us at our GPMs every Thursday.
Sorry, 30 to 8:30, guys. Yeah. If you have any like questions you want to ask, just like one-on-one, because we'll be here for a while, so